My name is Mariana Vicente. I'm the Director of Services and Projects of GAT, a community-based led organization based in Lisbon, Portugal. I have been working on the field of HIV and with key population over 20 years now in different roles. Currently, I'm a proud member of the AIDS Action Europe Steering Committee. GAT has been a member of AIDS Action Europe for many years now, and it has been very important to supporting our advocacy work, but also in supporting us with sharing experience with other organizations, in learning with other organizations, and having access to different tools that allow us to improve our work in a daily basis. GAT is a community-led organization founded in 2001 by a group of people living with HIV with three main objectives: improving access to prevention, harm reduction, early detection and treatment for HIV at the first, and eventually we added viral hepatitis, STS and tuberculosis. The second objective is to build the capacity of priority groups to increase their participation in health policies and decisions, and also to increase health literacy and knowledge production. This is because we believe the best health policies should be evidence-based and should incorporate the community knowledge and experience. Our main priority areas where we work are effective prevention, early diagnosis, access to health services and treatment adherence, universal treatment, tackling discrimination and stigma, health literacy, and working in national and European advocacy. GAT's work is quite broad, meaning it spans across various key areas, such as advocacy to influence policies and drive positive change, promoting partnerships by fostering collaboration among different stakeholders to amplify our impact, and service delivery, ensuring support and services reach the communities that need the most. Regarding our service delivery area, GAT currently has 6 fixed centers and 1 outreach service, all in the Lisbon region. So all these services you see here are open to everyone, so anyone can go to one of our services. However, we believe because key population have different needs, we learned from previous experience that it is more effective to have services that are more tailored to a specific key group, meaning that each one of these services, at least the services that we have in the center of Lisbon, are more targeting and more adapted to a specific population. For example, GAT Checkpoint, our first service at GAT, is working mainly with men who have sex with men. GAT Intendant is mainly working with sex workers, trans people, many of them are migrants performing sex work. GAT Afrique is working more with migrants, mainly from African communities. GAT in Moraria is a more complex service because it's also an harm reduction center, meaning that apart from the rapid testing and other clinical interventions, also as a drop-in, a drug consumption room, actually the first one in Portugal, in the south bank of Lisbon, because we have fewer centers and it's a big region. We have GAT Almada and GAT Setúbal that are not specifically tailored to a specific population, so everyone actually is accessing these 2 centers. We also have some support services at GAT, very important ones, namely the Anti-Discrimination Center, so a service supporting people that were discriminated due to HIV status. GAT Housing First, a program supporting homeless people living with HIV or using drugs or people engaged in sex work, and it's about housing. We also have GAT Para Pares, which is our peer navigation program, fundamental to provide support accessing healthcare and treatment adherence, and is constituted by social workers, but also with peers. And we have Love Condom program, that is our program responsible for the free distribution of condoms across the country, actually, and we normally distribute almost 2 million condoms per year. So this is to show you how our services are located in the region of Lisbon. As you can see, 4 services are based in the north bank of Lisbon, so the city center. And we have 2 fixed services located in the south bank of Lisbon, in Peninsula de Setúbal, and also the outreach service with the 2 mobile units operating there from Monday to Friday, all services. GAT is also responsible for promoting the community screening network in Portugal, which is a partnership between GAT and the Public Health Institute of Porto University. The Community Screening Network has more than 20 member organizations, all of them performing rapid integrated testing and using the same questionnaire, which also allows us to have a community epidemiological data collection through the university, which is a very important input that we can provide also to the NHS. And GAT is responsible for training the organizations to provide rapid testing and also to provide some materials such as tests whenever funding is available and to ensure the quality of the program. GAT services and centers provide the following activities. So some of these activities are common to all centers and some of them are more specific of specific centers due to the community they are working with. Rapid integrated testing for HIV, HBV, HIV, and syphilis. So this testing is done with criteria, and all GAT centers, fixed centers, mobile units, they all perform rapid integrated testing. Whenever someone has a reactive test, it's offered support to be referred to the hospital. As in Portugal, HIV and viral hepatitis treatment is only available in hospital settings. So through our peer program, we provide support to access healthcare, meaning removing some barriers, for example, for undocumented migrants, getting their provisional health number if necessary, if they are not nationals, and to escort them to the appointments. We also provide clinical intervention in some of our centers, mainly Checkpoint and Intendente and Setúbal and Almada. So we have appointments for STIs, nurse and medical appointments, mental health appointments with a team of psychiatrists and psychologists. And some of the centers also host decentralized hospital consultations, meaning the hospital is coming to provide the consultation, which is very important to reach a population that struggle more to access healthcare for different reasons. So we have consultations to treat viral hepatitis, B and C, PrEP consultation, and STI consultation in the South Bank of Lisbon at our GAT Almada Center. CAD, through his work, contributed for important changes in Portugal. HIV is not criminalized in Portugal, but sometimes we find something in the law or we find some inequalities that we try to overcome. For example, through CAD's work, it was possible to change a law that now we have a new law called the right to forget, which is about ending the penalization of people living HIV in life insurance conditions and policies, for example, but also was responsible for advocating for the removal of the exclusion criteria for people living with HIV, accessing, for example, some public careers like the military career. Another milestone, it was the start of the provision of specialized services tailored to different key populations. We started in 2011 with the GAT Checkpoint LX, working mainly with MSM, because from 2001 to 2010, GAT was mainly a political organization, so we didn't have service delivery until then. In 2003, it's also an important moment, and we see that some countries nowadays are still struggling with demedicalization of rapid testing. GAT was able to do it already in 2013, and it was the first NGO having trained peers and community health workers providing rapid testing instead of health technicians like nurses and doctors that was in the past. 2015, it was a very important year for people living with hepatitis C. It was the year that we in Portugal had access to universal treatment, and Portugal was also actually the first European country where hepatitis C treatment was universal to all, and GAT played a key role in advocating for this great achievement. In 2015, GAT was responsible for implementing the Community Screening Network in a partnership with the Porto University, the Health Public Institute of Oporto. And this network comprises more than 20 organizations performing integrated rapid testing for the 4 infections. We all use the same questionnaire, and we submit our data at the university, allowing us to have community data about these infections, which is a very important information that we also provide to the Ministry of Health. GAT is responsible for providing the training to the other organizations regarding how to perform the test and to ensure the quality of the process, and the university is responsible for managing this cohort. In 2019, we implemented a new network called the Lusophone Community Health Network under the scope of our partnership with Coalition Plus. This network promotes a partnership work in Portuguese-speaking countries, mainly African countries and Brazil. They are now 11 organizations, and still a work in progress. So we have been working for the past years in having PrEP in the community in Portugal, which is not still available. Now the legislation is already there, so we are finalizing our work together with the Ministry of Health to implement the first PrEP community services, hopefully from January 2025, and they will start at GAT, at checkpoint and intendant services. I would like to wish a very happy birthday to AIDS Action Europe. 20 years is a major milestone. It's very important that you keep your very good work, because it's really driving positive change at European level, but also supporting community-based organizations at national level to improve and to give more visibility to their work. So I hope that you'll continue this meaningful work and more 20 years to come. Muitos parabéns, AIDS Action Europe.